The chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, has stressed on the need for more caution as Nigeria continues to reopen the economy. He says the call is pertinent in the face of the repeated disregard to the non-pharmaceutical interventions, including the wrong use of the face mask. Mr. Mustafa restated the need for travelers into the country to take the call for self-isolation seriously, saying that Nigeria cannot afford another importation of the virus. While commending Jahisi for calling off the strike, he says he hopes the call-off is final, saying that this is not the time to show fatigue in the fight against COVID-19. In the meantime, for the Minister of Health, Dr. Osage Hanire, while noting that the daily cases of infection is on a downward trend, he says we cannot rejoice yet as there is still the need to conduct more testing. He's asking states to increase testing, saying that Nigeria is still very far from the 2 million testing target, calling for strong caution as many states plan to reopen schools. The Regional Expert Committee on Traditional Medicine for COVID-19, formed by the World Health Organization, the Africa Center for Disease Control and Prevention, and the African Union Commission, has endorsed a protocol for Phase 3 clinical trials of herbal medicine for COVID-19. Now, according to the Director of Universal Health Coverage and Life Course Cluster at WHO, like other areas of medicine, sound science is the sole basis for safe and effective traditional medicine therapies. Mr. Stephen Chubiyojo is a pharmacist and specialist drug quality control and drug production. He joins us from Abuja studios. Thank you for joining us on the program.
Thank you.
First, has Africa gotten, or rather, how far has Africa gotten in terms of clinical trials on traditional medicines for possible vaccines, for other diseases in the past?
Currently in Africa, in the time past, there had not been much that was done on our herbal medicines. But with the advent of COVID-19, it is sharing and quite interesting to know that WHO, the African Region Office, has approved a protocol for clinical trial for traditional medicines. And what this means is that there won't be any wild claim anymore. Because a lot of people in Africa, traditional medicine practitioners, keep claiming their herbal medicine can do so many things without scientific basis. So the Phase 3 clinical trial is to establish, one, safety. Number two is to establish quality. Number three is to establish efficacy. And safety is the gold standard for drug production, drug manufacturing, everywhere in the world. So the same standard that is being applied to the orthodox medicine, the allopathic medicine, is the same standard that is being applied to the traditional medicine. So with the Phase 3 clinical trial being established, having a protocol being established for clinical trial for herbal medicine, it means that anyone that passes this Phase 3 clinical trial can be mass-produced and it will be approved by regulatory agencies within that country. For instance, in Nigeria, we have NAFDAC. And that committee that has been set up by WHO now will help to guide the committee, the regulatory authority in each country to ensure this protocol are strictly adhered to.
In terms of the initiative, working towards a herbal medicine for COVID-19, what are the chances?
Currently, it is interesting to know that NAFDAC in 2019, March 2019, had established Herbal Medicine Product Committee. And this Herbal Product Committee, what their responsibility is to check the efficacy of herbal medicines that have been submitted for a particular claim. Currently, we have about 40 samples that have been submitted to NAFDAC with claim of activities against COVID-19. That's quite interesting. So with these 40 items, NAFDAC is currently working on them to prove the claims of this traditional medicine practitioner. And among these 40 herbal medicines that have been submitted, it includes that of Professor Maurice Iwu, a pharmacist. He has a traditional medicine that he has submitted to NAFDAC with claim that it has activities against COVID-19. So these are all high-profile claims. And we believe that at the time NAFDAC is through with them, they will be able to go through their phase 3 clinical trials. And once that is done, they will be approved for use in the larger market. In the phase 3 clinical trial, there is comparison with the standard drug. And that comparison will help us to know if that drug can do exactly what it claims, what the practitioner claims it can do. With that in the pipeline, I think we're on the right pathway in Nigeria.
We'd like to thank you, Mr. Stephen Chibiojo, pharmacist and specialist drug quality control and drug production. Thank you for joining us on the program.
Thank you very much.